my name is Verena Orzakowski, and we will be measuring body comp by using the Skinfold method. The Skinfold method measures subcutaneous fat that reflects the total amount of body fat by using an instrument called the caliper or a measuring tape. To measure body density, there are different equations that depends if it's a 7-site, a 3-site, and on the genders. To determine the percent of body fat, there is a table that shows the percentile range depending if it's good, bad, fair, very bad, and it shows the age groups. We're going to do the chest measurement. For men, we're going to do 1/2 of the measurement, and then for women, it's going to be 1/3. I'm going to ask her to cover her nipple, and I'm going to measure from the anterior axillary line to the nipple, and I'm going to make a mark. I'm going to ask her to move her sports bra down a little bit. I'm going to take the caliper, I'm going to ask her to move down her sports bra again, and I'm going to pinch first, and I'm going to take the caliper, measurement, release it, and then unpinch. Now we're going to do the tricep measurement. We're going to measure from the cranium to the elbow, and I'm going to ask her to hold this on the top, and we're going to measure halfway. I'm going to pinch, and I'm going to ask her to flex her elbow, and then unflex, and then I will pinch, get the measurement, unpinch, and unpinch. Alright, we're going to do the subscapular measurement. We're going to look for the inferior angle of the scapula. I'm going to ask her to remove her sports bra. We can also do the chicken wing if you can't find it. The hers is easily palpated. And then it's going to be a diagonal line. I'm going to ask her to pull it down, her sports bra, and then just grab as much fat as you can. And then pinch with the caliper, get the measurement, unpinch, unpinch. Now I'm going to do the mid-axillary. So I'm going to ask her to find her xiphoid at the end of her sternum, and we're going to line it up to the mid-axillary line. I'm going to ask her to pull it up. And it's going to be a vertical line. And just mark it. Now we're going to pinch. I'm going to ask her to put her shoulder, or her hand on my shoulder. It's going to go underneath. And then I'm going to pinch with the caliper, measurement, unpinch, unpinch. We're going to do the suprailiac measurement. It's just the anterior axillary line. I'm going to ask her to pull down her pants a little bit so I can find the crest of the iliac. And then you're just going to fold up a little bit and make a line. Now we're going to do the measurement with the caliper. I'm going to ask her to pull down her pants. And this is going to be a diagonal fold. Pinch, pinch with the caliper, unpinch, unpinch. Now we're going to do the abdominal. So it's just the belly button, just place your thumb 2 centimeters to the right of the belly button. And then just mark it. I'm going to ask my client to pull down her pants a little bit so I have access. It's a little awkward. Just going to grab as much fat. Pinch, pinch with the caliper, unpinch, unpinch. Now we're going to do the thigh measurement. I'm going to measure between the inguinal crease and the patella. I'm going to ask her to hold the measurement and put it in the crease and lift up her knee. And I'll measure it halfway. I'll ask her to lift up her pants, and then I'm going to grab as much as I can. I'm going to ask her to flex, unflex, and then measure whatever left. unpinch, and then unpinch again. All measurements should be taken on the right side of the body. The caliper will be directly on the skin and it will be perpendicular to the pinch. So both elbows should be up and you will pinch first and the caliper will come next. And you have to wait 1 to 2 seconds before reading the measurement on the caliper. We have to take 2 to 3 measurements of each side, but the range has to be within 3 of each time you take the measurement. Before doing one side 3 times, we need to do all 7 and then rotate and do all 7 again so the skin can resurface and regain normal thickness and texture. So the 7 sites that we will be measuring are the abdomen, the subscapular, the suprailiac, triceps, chest, mid-axillary, and the thigh. The 3 diagonal folds that we will be measuring are the chest, subscapular, and suprailiac, and the rest are vertical folds.